All right. Good morning, everyone. Good afternoon or good evening, depending where you are. Uh, Hi, Dogun. So we are very excited that you could join us for this webinar today. I'll let Dogun, you want to make some remarks before, even about the structure, what's coming up next week, and then we can get started.
Yes, good morning, everybody. Well, at least it's good morning here in the US on the East Coast. Thank you so much for joining our second session of the AI Catalyst and Global Health course. I think everybody received my last email. I apologize. There was some um issue sending so many emails to so many attendees, but I finally figured it out. And then I did a follow-up with the course syllabus. And just one note to make is the Zoom link is going to be the same for every lecture. I think there was some confusion about that today, so we were giving everybody a little bit of time to kind of come back in. And besides that, the only reminder is we will send out the survey around the middle of our lecture. And it'll be similar to last week's one or two quick questions, mostly just to see if everyone's
Yeah.
understanding the lecture and everyone's awake and participating, but should not be hard. But please complete that so that it can go towards your attendance. But yeah, I hope you enjoyed our second lecture of the course and let me know if you have any questions.
All right. Thanks so much, Dogun. Yes, today's course is lecture number 2, and with me today, we actually have a couple of um, speakers or invited lecturers that are going to present this with me. But I want to start by introducing myself. So I am Professor William Gua. I'm a founding director of the Global Health Catalyst initiative that has started at Harvard and Johns Hopkins and is extended to other institutions. Um, we will also have today joining us from Nigeria, Dr. Alabi Adewumi, who is one of the stellar doctors at the Sierra Leone Cancer Center in Nigeria, also affiliated with Lagos University Teaching Hospital. And then we also have Professor Stephen Avery, who is the director of the Global Health Catalyst at the University of Pennsylvania. Today's lecture is going to focus on oncology, but it's always important to kind of think about what we talked about last week. In case you missed the lecture is already available online, and I think the link was sent out to anybody, so you can watch that. Same thing after this lecture, you'll be able to get a recording of this lecture. So in terms of the flow, we're going to start with a few basics recall of AI in health, and then we'll talk a little bit about AI in oncology. That's the focus of the lecture today. And then I will introduce Dr. Alabi, who has a real good case study, to a case study that she can share from Nigeria. And then and then after that, we will have some opportunities to discuss Q&A. But during the lecture itself, I'll have a chance to always ask questions, so that this is going to be really interactive. You can answer the questions in the chat. And the first question is really going to be, we're going to start with a question about, for those who were able to attend last week, or if that's just your basic what do you understand about artificial intelligence, AI? So invite everybody to, if somebody were to ask you, what is artificial intelligence? What would you say is artificial intelligence? If you can type something in the chat, or I just want to I'm curious to hear what people would think. Yeah. Any other answer? A new technology that facilitates us humans to facilitates us in daily practice. Yes. Training computers what humans do. Okay. AI is an embodiment of several expert knowledge in various fields, but together. Thank you. Simulation of human intelligence. Excellent. All right. So thanks for these answers. I think the concept, everybody kind of gets it in terms of what it is. But in terms of what the general definition of this is really aligned with all what you guys have been talking about. So AI is essentially, um, a way that we try to make machines perform tasks that typically require human intelligence. A very simple AI example, obviously, is Google. If you use Google to search things, actually, that's artificial intelligence. Um, Language translation is a very good example. Image recognition, um, clinical decision support, and and then we really know that AI is one of the great opportunities that, as we start with this course, do go and really, I think the title of AI Catalyst for Global Health, AI really provides a tremendous opportunity for us to catalyze global health. So if you paid attention from last week, one of the key things we wanted to talk about was what is the difference between machine learning versus deep learning. I promise you that after this, we will not talk a little bit about no details about computer science or AI here. We'll just talk about how to apply them. But really important for you to kind of be able to distinguish what this is. So does anybody know the difference between machine learning versus deep learning? You've heard these words fly around you. Um, the question is, what is the difference? And did you get any of that from last week? Very curious to see what participants think here. All right, thank you, Jacques. Jacques says, deep learning is a subfield of machine learning, which employs neural networks. Excellent. Um, that is true. So basically, if you think about, you know, two things. So machine learning really is algorithms. So we say algorithm is just computer code that can learn from data. So, and we can think about, you can give the machine images of cancer, and then it's going to learn from those images so that the next time you provide an image, it can be able to distinguish what is cancer and what is healthy tissue. Um, and like Jacques said, deep learning is really a subset of machine learning. Typically for machine learning, the amount of data needed to train the AI, because obviously you need to make it recognize these features, is usually moderate compared to deep learning, where you have much, much larger data sets. And one big takeaway that you want to think about here, examples of machine learning, really just prediction models. You may think about that somebody comes to your hospital, and you can be able to predict who is triage that and say who is the most urgent patient that you need to address first. Can predict whether you are going to survive from your pathology report, whether you're going to survive from the disease, things like that. Image analysis is much, much deeper learning. It requires machine learning. But you can really summarize by saying that deep learning is a powerful branch of machine learning that's, really doing more complex tasks. And that's very similar to what Jacques mentioned. Okay, so right. So all of you can essentially write code. I just want to put that's the last slide I want to talk about as think about from last week. We can build a basic AI model that can, identify cancer and non-cancer using deep learning. This is not complicated. Actually, this is all free. You can download Python. You can use Python and Google Colab, and you can actually write your own code and train it, to be able to detect cancer. For example, when you upload an image, if you have a lot of images, you can train the AI so that when you then submit a new image, it can tell you whether you have cancer or not. And I just want to tell you that these are tools that are freely available today. If you really want to do AI, this is not something that is is meant for people who are, who are super experts. Anybody can actually write a code, that can do do AI. So this is really important. And I just want to mention that, as we think about the potential for AI in global health, one of the big advantages that we have here is that the scalability, right? So if we develop, a deep learning model or machine learning model, it's going to be applied across, multiple sectors, in different countries. I know many of you are joining from different countries, so you can use um, the same technology across these different countries. One of the key things that machine learning also provides for us is the idea of consistency, can reduce human error and variability, and allows us to task shift. So if you're a doctor and you need an assistant, obviously, AI, we know that in the future right now, AI can really help you support, the work that you're doing. So that's really, really important. Somebody has said that AI can do for healthcare what mobile phones did for communities, for communication in Africa. So it can really leapfrog. I can tell you, my mom, in a village we never had landlines, right? But now she can use AI models on WhatsApp. We really leapfrog from no telephone to um, to using WhatsApp, and so mobile phones. And so I think that AI can do the same thing in healthcare. So I'm going to transition right now to the focus of the topic today, but I want to mention again that if you are joining, access to lecture one, really talking about introduction to AI in global health, is already available online. You can download that. The syllabus is also available online at the same website. Um, you can also join the YouTube channel where all the lecture videos are going to be posted afterwards. So these are things that, if you missed any part of the lecture, or any of the lectures, you can always go there and you can watch that. All right. So we are going to transition to the lecture of today. We have a pretty good number of people who have joined. We had over 700 people who have registered for this course across different countries. There's definitely a huge excitement around what AI can do for us today. But today we'll focus only on AI in oncology. And the big questions that we want to ask is, if you leave the course today, how can AI enhance oncology care? If you begin from prevention, cancer prevention, to diagnostics, to treatment, to palliative care, how can we use AI, to enhance that? And then we'll talk a little bit about a big initiative that is being launched with a lot of major funding, to start the Comprehensive Cancer Center in the cloud, which is going to be essentially a center that, you can access the same quality of care. That's the vision that you'd get at from anywhere in the world. It doesn't depend where you are. If you know somebody who has cancer or you need support, you can be able to access those tools from anywhere in the world. And this is really one of the main projects that the Global Health Catalyst is involved with. And then I'll invite Dr. Alabi. Maybe we'll actually start with that can give an example of how AI is being used in oncology, a really clear case study of the work that's been done in Nigeria. And then we'll have Professor Avery, who is going to talk about the workshop that's coming up, and then opportunities and discussion. So we're going to go quickly through this. I actually think, we will start with, as we think about AI in oncology, we're going to start with Dr. Alabi to kind of share an experience that she has had in applying AI in her clinic in Nigeria. So I'm going to stop here and let's see, Dr. Alabi.
Okay, thank you, Will. Let me share my slide. Hello, Will. Can you hear me? Hmm? Oh,
Yes, we can hear you.
okay. Thank you.
All right, go ahead, Dr. Alabi. If you want to say some words to
Oh,
introduce yourself, you can start. Go ahead.
you want me to say some words? What did you say? Sorry, I didn't hear you. Okay, good afternoon. It's afternoon here in Nigeria. Good morning and good day, everyone. I'm a clinical and radiation oncologist in Lagos, here in Nigeria, one of the foremost cancer center here in Nigeria. I've been invited, and thank you, Will, for this invitation to share what our experience is with the use of AI in oncology practice. So I'll be sharing from our experience here. We have a case study. We have had a review of how it has been with us with AI over the years. So I have no conflict of interest, and I'll just go straight to what I want to talk about. Um, for us, AI is a beautiful experience because if you look at it, cancer incidence is increasing globally, and we have a lot of challenges here in the developing countries where we have a high rate of incidence and mortality. And this has led us to have to need resources that will make our work and job easy. And AI comes very handy and very useful in this context. Radiation treatment planning involves a lot of experts using computer systems, using complex protocols, algorithms, just so as to deliver precise care and treatment to our patients. And so because of that, we are able to offer treatments to patients and reduce waiting times we spent on the planning of the patients. You know, each patient has to be planned separately, individually, and then you have to pay attention to this. You have the oncologists doing what we call treatment planning. They have to do organ at-risk delineation, delineate target organs, and so all that is a lot of work for us. And because of that, we need the medical physicists to also be able to do their own plan, arrange planning beams. And so if you have a ton of patients to plan in a day, in a week, in a month, you end up having physicians, health workers who are experiencing burnout because of this. And so AI plays a vital role for us when we come to oncology care. Artificial intelligence, what we've been discussing, it enhances accuracy, efficiency, patient outcomes, and it supports cancer screening, clinical risk prediction, and radiotherapy planning. And so when we look at all this, it's very important for us to know that AI can do some things that you may have human error with and can help correct that. And so because of that, it's very useful for us. So we have it enables us to have robust infrastructure, skilled workforce, you know, when we have to use the AI tools. And so we need a lot of experience to be able to operate these tools. So that's because let's also remember that we are treating humans. And so we must not have errors. We must make sure that's where we come in. We must make sure that the treatment we offer will not result in errors for our patients. So the aim of our study was to look at the role of AI, just generally what we have done so far. We want to look at the physician's perspectives, their perceptions, their knowledge, their attitudes. Are they practicing? Are they using it? What are the challenges they have? What are the limitations? What will they need to make it work better for them? The study design was such that we looked at two fields of specialists, the oncologists, okay, consisting of consultants and residents who work in that phase, and also medical physicists. And so we looked at oncologists who are dealing with breast cancer, prostate cancer, all cancers that we use it for, and then the medical physicists who are also planning in this treatment. So we had a total of 31 healthcare providers who were using the software, and we evaluated what they were doing. The study was carried out at our center, NSI Elite Cancer Center is the foremost in West Africa. We have a dedicated CT scanner for simulation, and then we also have 3 linear accelerators, 2 Vita beams, 1 Halcyon. We also have a 3D high dose rate brachytherapy machine in the country of 200 million population, over 200 million population. We are the only ones who have high dose rate brachytherapy machine, and so you can understand where that will come in. That means our patient load will be high, such that we have an average of 120 cancer patients receiving radiation therapy daily. Okay, so our patient load is really, really high. So, and we have few professionals working in the whole country. We just have on the average about 100 clinical and radiation oncologists. Okay, for that population, that's a lot of work. So presently we have 11 clinical and radiation oncologists, 10 residents. We have about 12 medical physicists. We have 12 radiation therapists, and we also have oncology nurses. The instrument that we deploy as our AI tool is the rad formation. We had experience using MRM and Carina. So, but I think we settled for rad formation. I don't know the details of why we chose rad formation. Probably the cost, I don't really know, but that was what the management settled for. We did some statistical analysis with our result, and we had ethical approval. So these are the respondents who filled the survey, the oncologists, the medical physicists that filled the survey. So if we look at the experience, the AI tool has been around for about 2 years. And so we had to look at, are they even using it? Do we have the oncologists and the medical physicists using it? And so we discovered it for 6 months, 2 years, 1 to 2 years. Okay, so we evaluated that, but it was found that the oncologists were using it more. Okay, we had the oncologists using it more. We also tried to look at what the challenges were with the medical physicists, where they were not using it as much as the oncologists, and but we've discovered that the oncologists were using it more. 3.3%, while a very few, 13%, had used it for 2 years, despite the fact that it was bought. Initially, we had a trial phase, then it was bought, and then before we got people to embrace it, okay? So it was difficult. It was also a challenging phase because we didn't get a grasp of it on time. And so until we realized that we're wasting money if we don't use this tool, okay? So we had to train ourselves and get retrained and retrained, and then we started using it. So that may account for why very few people use it for 2 years, and you have a greater number having used it for 6 months to 6 to 12 months to 1 to 2 years. So we looked at the responses, okay? What role has it played for contouring patients, breast cancer? And then we discovered that this bar chart now shows comparison with use of the AI tool and what we call regular contouring. Okay, regular contouring means that we are manually contouring, drawing the volumes as they should be, going around the organs at risk. So you know that will take more time than if you just have to punch some buttons, pum, 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 and then it gives you what you will need without you having to manually do that. And so with the AI, you just have to also look when you are done pressing the buttons and picking what you want to make sure that that is what you want. So that's the only part you have to play to make sure that what you really want to be contoured is what is contoured. And so for the looking at the figures, it was discovered that there was a time reduction. Okay, definitely there will be time reduction. And so we could see the significance of the time reduction when we look at the patients who were contoured for looking at the breast contour, for example. Now we had we had people who spent between 30 to 45 minutes, okay, almost having about the same time, like about 33% of people who spent about 30 to 45 minutes. But if we look at people who spend 15 to 30 minutes with the AI, we had a greater number of people, okay, about 45%, okay, spent 15 to 30 minutes contouring the patients with AI, which was looking at. I think we if you for the head and neck, okay, there's a of control of, okay, so that just means that contouring for when you look at contouring with sorry about that. When you look at contouring with the AI, okay, so it's much time. It takes much time with for head and neck. It's more challenging with head and neck. Okay. Okay, I think I was talking about prostate cancer when I said 15 to 30 minutes, and you have about equal number of people using 15 to 30 minutes. And so it also differs in the sense that when you look at some of the contours are easy, straightforward. Some contours are not easy. They are not straightforward. And so, but I think over time on user experience, okay, we also not comparing the tool that the patient, the user, especially the oncologist now, the AI tool had positively impacted my practice in the radiation oncology unit. We see that 52% of the respondents strongly agreed. Okay, so that's a significant thing for us, that they think that it has, so half of the respondents think that it has strongly impacted their practice, and that is good for us. I would recommend the AI tool to other professionals. Yes, highly recommendable, 65%. Using the AI tool has significantly influenced my overall confidence in practice. So that's neither here nor there, okay? So maybe when it comes to that, it may be a bit subjective, because we will not say if it has really helped with improvements in outcome. Okay, it might just be with improvement in making things easy for the physicians and the therapists um and the medical physicists. So it might just be about improve that evaluated plan. You see that same there is not more, is not really to improve personalized treatment plan as such. It's just to make our work easy, and that is obvious from what we are seeing in this survey and the outcome of our survey. The primary benefits and the limitations. The benefits are what we have on the left. And so we looked at better patient outcomes, improved timing, enhanced treatment planning, improved accuracy, increased workflow and efficiency. And this is similar to what I've just showed in the previous slide, that says it actually gives increased workflow efficiency. So we see that a lot, which is about 81% agreed to that it increases our workflow efficiency. And they said improves accuracy too, which is not bad. So if we're okay with so what that simply translates to is what the AI does for us is that what I would have done if I did a regular contour. And so it may even do it better, because I may be in a hurry. I may be in a hurry to plan a patient, and I just want to quickly do this patient and go. But the AI will make it easy for me to do that. And so, yes, it will improve accuracy over time, and it's doing that for us as well. What are the limitations we have? Costs of AI accuracy, time, hardware availability. So we picked the common, the most prevalent limitations that the respondents gave, okay, as answers: network availability, technical know-how, license for use of the machine. So this translates across for the physicians, and you can see that license, technical know-how were strongly identified, okay, as issues. And what license means is that we buy license to have as many providers on a system. And so probably we just have license for 20 people at a particular time. And so that means if 20 people are on it, you can't use it until somebody else logs out. And so that costs a lot of money to get more license. The technical know-how too was a big of an issue. And I think it's something that we also spoke about along the line. So our AI, okay, has significantly reduced radiation therapy planning time. No doubt, that is confirmed. It has really reduced our workflow. More efficient clinical workflow by reducing administrative, and also improving decision making. So that has really helped us as well. It has enabled real-time patient monitoring and also proactive side effect management. So AI can do this, but we have not started implementing this as our own use of AI. A greater percentage of the respondents, 63%, said they would recommend the AI tool to other oncology professionals. Okay, so when we have to discuss with others, we recommend to them, and so that they can also use it. So when they come over to our center, when they visit us, we recommend AI to them and ask them to get it so that it can make their work easier and faster. Most users did not adopt the software during that period of 2 years post-installation because of the challenges of technical know-how, struggling to see how to do it, and we have to keep reminding us, oh, you have to press this button, oh, you forgot to click on this. And so those were some of the challenges, but over time I think we have improved on it. So this is just a summary of what we have done. The survey was conducted in our center, and I've told you our patient load, we have about 10,000 cancer patients yearly that visit us at the cancer center. And so we do not only offer radiation services, we offer chemotherapy, targeted therapy, brachytherapy. So our volume of work is huge. And so we cannot afford to spend so much time only on planning patients because there's so much to also do. The survey assessed reduction time spent on contouring and treatment planning, user experience, satisfaction, ease of integration into the workflow was really important for us as key points here. Our key findings: significant reduction in contouring and planning time. For cervical cancer patients, 39% completed contouring less than 15 minutes. That is remarkable for us. If you have 40% of plans of cervical cancer plans finished in less than 15 minutes, so you can do as many as you want in a day. Okay, then we have over 70% completed in less than 30 minutes. So in contrast, only 17% achieved less than 30 minutes using the standard, non-AI method. Okay, when we use the regular contour, which that is, you don't find many people being able to finish their contour within a short period of time. They will spend more than 30 minutes, and that's not fun. Okay, so you have so many other things to do, and so you won't want to say that. So similar time savings are observed for both breast, prostate, and head and neck cancers, and users reported improved job satisfaction. Okay, I'm always excited. I think I'm one of the people who is always excited when I have to use the AI to plan. It just makes life easy for me. Okay, helps to reduce cognitive burden from complex planning. Sometimes you also have challenging plans, but with the AI, it helps you to figure out what plans where you need to make adjustments, and it just makes it easy for you. The impact of time savings, what has this done for us? So you have more time to take care of other things, other patients, more time to listen to them, to listen to patients. You are not in a hurry to listen to them because you finished your plan. So you have more time to attend to them, to engage them. It enables treatment of more patients per day. because so you don't have to delay patients. Waiting time is reduced. Okay, so even especially those who have urgent care, who, you know, maybe there are emergencies, you can quickly use the AI and your plan is done and patient can be treated on the same day. So these are some of the impacts of time savings for us. What are the challenges we have with the AI? Limited technical support. So from time to time, we have to do training of the trainers again. We have to keep training ourselves to use the AI software. Poor user interface and usability of the current tools. I can't boast that we are using it optimally. I can't say that everything about the AI that we have, the software we have, that we're using. I'm sure there's so much to it that we can do that we don't know. And so that would also be that's a challenge for us too. So we need to get people to come around and say, oh, but this is also there. Are you aware you have access to this? You can also use this. Then low adoption rates. We could see from the analysis that not so many people are still using it, even since we've had it for 2 years. Then we have gaps in the infrastructure, workforce development, help. We need to integrate AI. I've just talked about we have over a 200 million population, and we are saying that we have AI in one center. Okay, what of all the other centers that have oncology care? Can they also get it? And that brings us to the issue of cost. It's very expensive. Okay, it's only a center like ours who has we're both a public and private, okay, hospital. So we have involvement of private, and that's the only reason why we can afford to pay for a software this expensive. So limited availability of equipment, limited access to advanced treatment, all these things comes to play. And if we get access to these things, they make life easy for us. In conclusion, AI in oncology is an exciting field. Okay, if you've used it before, you will know that it's really exciting to use because you just see everything being done for you. Okay, efficiently educating clinicians is very important. We can't leave it all to the AI. Remember, we are dealing with humans, and we have to make sure that this is cancer. If the patient is not well treated, then the tumor will recur, and that would not be good. So we shouldn't use the excuse of the AI to not treat patients well. We still need to try to do Q&A, okay, like quality assurance to actually compare. Okay, do we have limitations in covering those that should be tumor that should be covered? Is it covering how well is it covering it? Do I still need to check even after using the AI? So we still need to have all that in place. Existing AI tools have limitations, inefficiency, lower sensitivity for some particular patients. You know, we have different patient complexity, homogeneity, and what have you. So we still have to figure it and find a way around all that. By focusing on the needs and expectations of physicians, we can actually foster a positive and productive interaction. Okay, when we keep engaging ourselves and we look at what I've learned, what we've learned, and then we try to put everything together, and that way we can get better. These are a few references that I made use of, and I cannot do this presentation without acknowledging these wonderful people who took time with me to look at the data. We analyzed it together, discussed it together, and this is what we came up with. And my prof, Professor Duro Simieti, was the one who championed us getting AI, and he made sure that it was a reality for us in our center. Thank you, everyone. This is a picture of the Cancer Center in Lu. Anytime you're in Nigeria, please feel free to stop by and say hello to us. Thank you. Over to you, Will.
Oh, wow, that was fantastic. Thank you so much, Dr. Alabi. It's just so powerful to see how you can use AI already. You're implementing that in your clinic in Nigeria. I mean, I think this is sometimes we talk about this in very abstract terms, right? So AI is the future, but for you to have actually implemented this and shared some lessons on how this can be used, how you're using that to impact your patients and clinical care is just fantastic. And so before we would change topics, I think actually we would like to give a chance for people to ask you some questions, based on this experience. Dugun, I don't know if you see any questions that you may want to ask Dr. Alabi.
Yeah, amazing presentation. We've definitely got some questions here, so I can do them one by one. So Gloria said, hi, thank you very much for this great presentation. And I think this was actually for Dr. Ingwa's presentation, if you guys want to take both. So we'll just start from the very beginning. For using the AI tool, number one, what is the total body detection of the cancer or local disease detection? Number two, what were the complications of using the tool? And number three, what was the duration for training for the use of the AI tool?
Yeah, so for me, I basically, when I talked about that, I was referring to pathology, how you can be able to detect cancer from healthy tissue. And the lecture next week, on Saturday, will actually focus. We have a stellar presenter who is going to talk about how you can they've installed a digital box already in Ghana that you can basically read a pathological sample in like 10 minutes using AI. So basically, you can do the biopsy. Now, most low and middle income countries, you have to send samples internationally and you have to wait for weeks and months to get diagnosis. But now we have this technology that's sitting on a tabletop that in the clinic that you can just do those pathology reports there. So that was just an example to say, AI is already widely available for use in diagnosis. And I'll talk a little bit more about that, in a few minutes. But I think, for Dr. Alabi, where she's applying this, so we see that, you can use AI in cancer prevention, cancer diagnosis, cancer treatment, and even palliative care, right? And what we see today from this presentation from Dr. Alabi is, presentation use of AI in treatment. So we're only looking at one box. Next week, we'll look at how you can use that for pathology, for diagnosis. So yeah, so that's the answer I would have for that. Maybe they have some questions for you, particularly, I see some questions for you, Dr. Alabi.
Yes. So the next question for Dr. Alabi is, have we explored integrating health promotion and prevention messages to enhance behavior change that can reduce cancer in the population?
Okay, so I don't know if that question is related to use of AI in contouring or in treatment. So that looks like a question that is related to diagnosis of using AI in making diagnosis. Okay, so but let me just answer a few of the questions I'm seeing here. So somebody wanted to know what time it takes for contouring if you have to do the manual contouring. Okay, so for different organs, for different breast, cervix, you have different timing. Head and neck takes a lot of time because you have a lot of organs at risk in the head and neck. You want to contour the eyes, the lens, the optic nerve, the chiasma, the brainstem, so you have so much to contour in the head and neck. Unlike if you're only contouring in the pelvis, where you have cervical cancer or prostate cancer or anal cancer or rectal cancer, you just have a few organs at risk: bladder, rectum, femoral heads. So you have a few things to contour there. Okay, so from what we discovered, if you're contouring for breast cancer, for example, now, okay, 42% of the oncologists spend less time. They spend 15 to 30 minutes if they use the AI tool. But if they are to use the regular tool, the manual tool, okay, you have about 27.3% of them will use up to an hour. They spend up to 1 hour. Like 30%, let's say 30% of them will spend an hour, compared to you having like 45% spending 15 to 30 minutes with the AI tool. So it saves time. And so same thing goes for the other organs too, such that you have less time. For the cervical cancer, for example, you have about 40% of the oncologists will finish their plan in 15 minutes. But if they have to use the AI tool, if they have to use the regular contour to finish it, then another 45% will spend up to like 45 minutes to do it. So you see that if we have 40%, if we have 45% using AI and spending less than 15 minutes, and you have 40% using the regular contour, spending 1 hour, that's a lot. Okay, so it's better to be on the side of the AI, because 40% of them using the AI finish their work fast, will end up finishing their work faster than if they have to use the regular contour, manual contour. I'm not sure I'm able. Okay, the Q&A. Are there other questions that have mixed? Because I saw that a lot of people were particular about what time difference. Okay, what time difference do you have when you have that? Okay, should I allow Dugu to continue reading the questions, or so I want to answer the ones that are particular to me. I think some Will has to answer. Okay. So I see another one. How can you use the AI in Monte Carlo calculation to detect the perfect amount of radiation you give to the patient? How you be sure that the prescription dose is given, how it is prescribed the same amount of dose. Okay. So for this is not what we are using the AI for now. Okay, this is not what we are using the AI for, except if the medical physicists are using it for this. But I know the medical physicists, they use the AI to do their plan, to do their beam arrangements. Okay, and not really to calculate what dose prescription comes out to the patient. But they just use it to do their plans, because their plans also take time. So that's the response I can give to that. Who developed the software, and why are licenses fees high? Okay, maybe we will help with that. Why are the license fees high? You're a medical physicist, you know about all the software things. Why are they high?
Yeah, I think for your particular the presentation that you gave, Rad Formation is a company that provided the software, the AI software for you, for the center that you used. But there are many other companies that are developing software that can help you plan the treatment for the patient. And so in this particular case, you used the software. One of the key companies there is Rad Formation. And why is it expensive? Obviously, they actually say the company has decided to partner with us to provide licenses for partners in Africa for free for a typical period of time, I think up to 1 year or 2 years. Professor Stephen Avery, who is on this panel, actually helped organize that. Maybe he can talk about that. But what has happened really is, and I know there was a question around that, how do you help train the AI? So some of these companies have used data, like I talked about at the beginning. To train AI, you need data, and a lot of that data has come from high income countries. I think there's a question from Nina around this, but these companies are actually really interested in also training the data with data that's from low and mid-income countries. For you to have a really strong model that you can use, you need diverse data sets. And so I'm sure that the experience that they're having with you, Dr. Alabi, in your center, actually is helping improve their model, right? And I know you are one of the first centers to use that particular company's platform. But there are many other companies that have this, and I think the price will go down. It just as
I
more
think so too.
tools come up. Yeah.
Yeah. I think I agree with you on that. That when we have more centers, the price will go down. There's also a question on the duration of training for the use of the AI. We had the software given to us for a trial period of 6 months, where it was free, before we now had to pay to renew the subscription. And during that period, we had 2 virtual trainings. And just with the 2 virtual trainings, we were good. We were fine. So the only thing I notice is that, sometimes when you have to learn something new, you come across some challenges. And then, so when we do have those challenges, things we do not understand, then we put a call through to the trainers and ask questions, and then they put us through on what to do and how to navigate whatever challenge that is. So that's how we've gone about it. So it's not difficult to learn. It's just like learning computer. It's not difficult at all. It's very easy and straightforward. What were the complications using the tool? Complications, there's no complication. I'm not sure there's any complication. To the users, no to us, there's no complication. It's just the limitations about getting used to it, knowing how to navigate and use it, what to look out for. So, and then you need to have a good network. Okay, you need to have good internet service. If you don't have a good internet service, it will be slow, and then you will end up spending the time you should have used for manual contouring. Okay, so that may be a limitation, but I won't see that as a complication. Was this a total body detection of the cancer or local disease detection? So this is not about detection of cancer. This is just for treatment purpose. This is for treatment purpose. I'm not sure. Did I leave any question unanswered? What ethical considerations were made during the ethics approval? Okay, so that's a beautiful question. So we have an ethical board review, and we have ethical clearance because this is not what type of so this is not a direct I'm trying to use, so we look at human research. When we're talking of human research, there are different categories. So this does not cause a potential risk to the patient. Okay, so there are no ethical issues here. So, but we got ethical approval to use it, but there are no expected ethical issues because it does not cause any potential risk to the patient. It's computer, you just use it. So you must be trained to use it. And once that is done, so there's nothing to be afraid of. How can AI be used to reduce or correct artifacts caused by dental meltdown in medical imaging? Okay, so we haven't started using it for medical imaging, so I will not be able to say anything about that. I think I saw a question. What do you think is the reason? What reason is the low or slow adoption of AI? Was a highly structured training program offer? Was adopting AI voluntary based on interest? So usually, when you are in this part of my world, okay, adjusting to the new things is usually a challenge. Okay, people find it difficult to change their way of life when something is new. Until they've seen people who have used it and are saying, "Oh, this is good, this is good, this is good." Okay, so that's what I see about it. And for me too, I think I fell into that category initially. Okay, I just didn't see it as anything. I just felt, of course, I'm doing my manual contour and I'm okay with it. So not until I tried it and I looked at it and I saw, oh, this makes my work easy, and so I now had to also encourage others to use it, to learn it, and then I think we moved on from there. So it's usually, I think it's more of a thing of the mindset. Okay, when you are trying to change to something new and you just feel that what you've been doing is okay, why should I change to something new? There's nothing wrong with what I've been doing before. So I think it's about mindset. So it has nothing to do with the structure in place. It has nothing to do with the training program. I attended the training once. I didn't attend the second training. And so when I was going to get on board to start using it, I just called one of the medical physicists who has been using it, and she put me through and I mastered it and I've been using it since then. I don't know. Thank you, everyone. I don't know if I have any other questions left unanswered.
Thank you so much, Dr. Olabi. I think that was a wonderful, presentation and answer to the questions there. If there are other questions, we'll definitely curate those and we can share that with you. I think this is just the beginning. I think the powerful aspect of your presentation was just to show that, people are using AI, already in their hospitals, and you are one of the leaders, I would argue, in Africa in doing that. So, thank you so much for that wonderful presentation.
Thank you. Thank you for inviting me.
Yes. So I will, before I talk about I see some more questions on the chat. Before I talk a little bit more about how you can use AI, this is just an example how you can use AI for helping with treatment. But I'll talk a little bit about how you can use AI to enhance other aspects of oncology. But because this is related, I would actually like to invite Professor Stephen Avery from the University of Pennsylvania, who is also the director of the Global Health Catalyst at UPenn, and who will be, is really a big advocate for AI and virtual reality and all the high-tech technologies in oncology, to share a little bit about some of the plans that he has for Ghana, and maybe you can comment also on the rat formation, the pricing thing, that question that came up, Stephen, that you've helped to organize with rat formation.
Thank you, Will. Morning, good afternoon, everyone. So I would just take a few minutes just to go over a workshop that we are planning for next week in Ghana. And maybe can I just share the agenda?
Absolutely. Go ahead. Yes.
Okay. Hopefully everyone can see the agenda, the sharing. And so this workshop is will be held July 2nd to the 4th at KNUST in Kumasi. So it's entitled Empowering Future Leaders in Cancer Care, VR and AI and Transforming Cancer Care and LMICs. And so originally we had a broader program, which was a global medical physics program that we usually held, but with the current travel restrictions, we designed this workshop as a way to still have a focus program where we can have an immersive experience for Ghanaian oncologists, medical physicists, therapists that can serve as a launch pad for building site-specific, I say AI or VR training strategies. So it's a workshop. So we keep it small. It's about 25 professionals across Ghana with a core group of about 10, let's say, medical physics leaders. So 10 young people that we see as the ones who are going to be the leaders in AI in this region who will participate in this training. So if you see on day one focuses on just an overview of artificial intelligence or AI in clinical practice, and we will begin with welcome from the provost, and then Dr. Andrew Maidman, who is a medical physicist focused on diagnostic physics, will give a presentation on some of the emerging technologies around AI with a focus on diagnostic imaging. Then we will present the Hypo Africa trial. Dr. Solomon from Uganda, who also had experience using Krana AI in his lab, will just share some overview. And then the tools which were developed by MD Anderson called RPA, or Radiation Planning Assistant. We just will talk about like how, like the overview and trying to implement that into the clinic. And this is where some of the young physicists or leaders will be part of that. And we also have an area, because we know one size doesn't fit all. Every clinic works differently. And so we will want like each individual site to work on what would the workflow look like in your clinic, because implementing these AI tools is something that it's specific to the resources that you have, the staff and everything. And so we want people to really think about what does it mean to implement these tools. And then day two is a little bit of a shift. So we're shifting more to VR and clinical education. We recently received a pilot grant working with IEA to like how do we introduce some of this VR training into the clinic. And so there will be an overview of the pilot.
Stephen, do you want to say what VR is? You just
Oh,
assume.
sorry. VR is virtual reality and clinical education. So people put on these goggles, and then they can be in a virtual world where you can see kind of the patient, how the patient's supposed to be set up, and setting the patient up for, let's say, for brachy, for cervical cancer. And so IEA has a training module that they developed for this type of VR education for GYN. And so they would like to pilot how can we use this for training in clinics that want to build capacity, but as a different method of using this virtual reality to build capacity. And so the idea is that if we can identify, again, two young people that we can, IA would like to send this to their training sites, sorry, to their anchor sites. They have a program called Rays of Hope. People may be familiar with that. And they have a number of anchor sites that are part of this Rays of Hope initiative. And so the idea is that they can send a couple of young future leaders to the training site to train them on how to use this virtual reality education. They will come back to Ghana and then they would be the trainers. So it's like the trainer model. And so this is something that we want to pilot. And once the idea is that this would be expanded across the continent and across the anchor sites. And so this is day 2, which we will look at and dedicate this to include structure planning sessions on incorporating VR into routine training and identifying some key priorities for digital learning and medical physics or in radiation oncology in general. And so in day 3, again, we want to emphasize leadership and sustainability because it's good to have these tools, but we want to make sure that we are preparing for the future, preparing for future leaders, preparing for making sure that it's sustainable. And so first, we have a panel of distinguished leaders in Africa, which includes Dr. Twalib Ngoma, who is the founder of the Ocean Road Cancer Institute. Dr. Beatrice Wafi, the CEO of Peace and Love, who's a visionary behind the Comprehensive Cancer Center of Excellence initiative. Dr. Eric Addison, who has pioneered the development of training medical physicists in Ghana. And also Dr. Elsie Kaufman, who's a Penn alum, who has headed the founding of the development of a Department of Biomedical Engineering in Ghana. So the idea is for them to share kind of their story, because as we're preparing for future leaders, we want them to hear from senior leaders that what their journey, what their path was like, that everything wasn't easy. There were some challenges, and just to share that, the path that they're about to go on, that you can do it, and they're sharing their stories on how they've got to the point of these amazing leaders in Africa, and now we're preparing for future leaders to be the future Ngomas and Dr. Wafis and Dr. Addisons and Kaufmans. And so the final part is will include the trainer. Like what does that mean? We talk about it, but how do we implement that? And so just to have some ideas of how do we prepare for the future faculty, the future leaders, and then some final steps, action items. And so we're finishing the last steps of the workshop, and I'll share the Zoom information with Will, and he can share that with everyone, so people can log in and hear and participate. So I think it's really shaping up to be a nice workshop. And we also have, at the end, after the trainer, there is one person from UPenn who's part of the kind of student life, and she's director of student life and undergraduate education, because we want to kind of build this connection, and how do we bring up the students, because they're the future. All these things we have means nothing if we don't prepare our young people, to step in and kind of lead and take over these initiatives. So thank you, Will, for giving me a few minutes to kind of highlight the workshop, and looking forward to having people participate, ask a lot of questions, and help us to build this foundation in the continent and beyond that. Thank you.
Thanks so much, Stephen. I mean, this is exactly the tools that we, as you mentioned through the agenda, these are the tools that you're going to be going through with this workshop. It's a fantastic group of people that you've brought together there. So I think those tools are some of the tools that we want to share, with anybody who wants to use this, like you talk about scaling this. I think that's the advantage of AI and all these technological tools, is that you can, while you're going to pilot this in Ghana, you can actually share this across other countries as well, so Yeah, so please, yeah, send a link. We'll share the link with all the participants today. Would follow up along with the video lecture that's been recorded, just so that if you want to join, you said that's July 2nd to 4th, right? People can join.
Yes.
Yeah, you can be able to, to see what the program will be like, and if you have time, you can join that. It's optional. It's not a requirement for this course, but it's just another resource that people can have access to. Um,
And
Thank you.
also, we are planning to record the session as well. So we can put it on the JC website so people, if you can't make it, you can come back and look at it later.
Fantastic. Fantastic. Maybe we'll see if anybody has a question or two for you, Steven. Yeah, about that. If no questions, you can just stay on a little bit. I just want to talk a little bit about how all of these fits into the overall Comprehensive Cancer Center in the Cloud initiative. And then maybe we can have, we still have about 20 minutes. So, and then we can have a little bit of questions, Q&A. People may have questions then. So thanks again, Steven. So I'm just going to transition a little bit and talk about how the lecture that you just heard from, Professor Stephen, from Dr. Alabi, and also how these initiative from Stephen, how all of that fits into how you can use oncology to enhance care. And so I'm just going to share a big initiative that we have been looking at, about how you can use AI to enhance oncology, care, prevention, diagnosis, treatment, and palliative care. So as you think about AI, you can really put that, from the Global Health Catalyst, the Global Oncology University perspective, you can put that across 4 boxes. One box is care, comprehensive care. So from prevention to diagnosis to treatment and palliative care. So palliative care does not only mean people who have already, people who are supported for survivors after that, but actually palliative care covers from the time when somebody is diagnosed with cancer and just needs that support, through their care journey. So you can use AI tools across each one of this, and then we are also talk about how you can use AI for outreach, for research, and for education. And so some of you already been posting questions about AI in diagnosis, which I mentioned briefly at the beginning. I just showed you at the beginning that anyone can write code today. You can go on ChatGPT and you can write code that can help you diagnose, cancer, essentially. It's that easy today. But I would like us to think about, and there's going to be a big lecture on this next week, focused on how you can use AI for diagnosis. And then the following week, we have another lecture that's going to focus on imaging. And so through this, you'll be able to really have time to delve deeper into the question of how you can use AI for diagnosis. But today you did see the example for how AI can be used for treatment, obviously to predict. Treatment is another area where AI can be used. But I would like to actually open up this point before I talk about the Comprehensive Cancer Center of Excellence in the cloud. I would like you to share, what do you think? How can AI enhance oncology care? Can you come up with some ways to where you think if we were to implement AI today, how can that help with prevention, or maybe diagnosis, or maybe treatment, or maybe palliative care? And when we say palliative care, we really mean supporting the patient, so that as they deal through their care journey, from the time they are diagnosed all the way to even when people pass away in dignity. So I would like to actually see what people think, in the chat, if you don't mind. Just share how you think AI can be used to enhance oncology. I just give a couple of minutes to see what people think. Any answers, people? You can post that directly on the chat if you have an answer. Okay. It looks like a tough crowd. We don't have any. Okay, I see answers coming in. Fantastic. Yeah, so AI can help in pathology diagnostics. That's going to be a big session next week. I can tell you, you have to attend next week. The session is going to be really amazing. AI can help in early detection as they may be more precise. Yes, that also goes with the diagnosis. Yes. Clinical decision support, excellent. I would say that that's one example where we hear a lot from doctors because of the lack of workforce. Sometimes doctors just want to get a second opinion, and AI, an assistant, can help you with that. Early diagnosis, yeah, I see a lot of that. Early diagnosis, prediction, yes, prediction in therapy. You can actually basically, by uploading a pathology report, AI can tell you what are the prognostics of the patient, and what are the current treatment options that, may be the best. Precision personalized medicine, I like that. Improved treatment planning, we did see that currently with Dr. Alabi's presentation. Yes, reminders and support. So I actually want to pick on that AI can provide patients with information reminders. So that's actually where prevention comes in. Think about the breast cancer patient who is in Alabama in the US and one who is based in Kenya. Think about how, with the mobile phone technology today, you can have this app that can actually send you alerts every month, to do a breast self-exam, to see whether you can catch, because one of the big things we see is that people always present with cancer late. But with this information, you can send alerts, you can do a breast self-exam, and you can, if you feel a lump, you can go and get a mammography. That can really help with preventive care, just educating and empowering patients. All right, so thank you so much. And enhanced telemedicine. So that's really good. And so, thinking about this, if you stop and think about it, the future really is that, what is happening at the University of Pennsylvania, where Stephen is, or at Harvard or Hopkins, or, in the top cancer center you can think about, right? How can we bring that same level of care, that quality of care, so that it doesn't matter where you are in the world, whether you're in Kenya, whether you're in Nigeria, whether you're in Bangladesh, whether in South America, you can have access to the same level of care, the same quality of care. It doesn't matter where you are born or where you are located. How can we do that? Does technology allow us to do that today? And what we have a really big, bold answer to that. Yes. With AI, with the advent of AI, you can have access to care in your community, on your phone. You don't have to travel long distances to access certain services. And even if you have to, you can have AI help to guide you through your care journey, not just for the patient. I think the big part of this is really how it can empower patients from prevention to diagnostics. People can take pictures of a cervical cancer tissue right now or an image, and it can already give you a diagnostic prediction from that. Treatment, we just had that. Doctors are using that. Palliative care. So how can we use AI to empower patients across their care journey? I think that's going to be a really powerful application of AI that people are already using. And I think the big thing now is how can you bring all these tools to one place? The same tools that are being used at the best cancer centers in the world, bring them to one place, put them in the cloud where everybody, it doesn't matter where you are, can have access to those tools. So like the tools that Dr. Alabi presented today and the ones that Professor Everett talked about that is going to be in the workshop in Ghana, we want to put those tools in the cloud where you can have access to them. If you are interested in imaging and diagnosis, that's your box. You can go there, you can download those tools, and you can use them. If you are interested in prevention, yes, you can download that app, which can help you create that, information that can help downstage cancer, prevent, catch it early, and help you modify your diet, your exercise, evidence-based, so that you can can stop you from getting sick in the first place. And then treatment and palliative care. So that's the vision. And so in 2017, we launched the Comprehensive Cancer Center of Comprehensive Cancer Center in the cloud, powered by AI. So I just want to talk a little bit about, just highlight a couple of things that are going on here and provide opportunities where, people can can really, be part of this. So what is a comprehensive cancer center? Just think about, the best cancer center in the world that covers care, outreach, research, and education, putting that in the cloud. So it doesn't matter where you are, you can have access to it. We see this as having just four, think about that as four features or apps. So one is just a care app. That's basically telemedicine. Some of you put that in the chat in the answer to how AI can help. Doctors really value that. You can have an iPad or a phone that helps you when you have the pathology report. It can already tell you, what are the treatment options for the patient. But guess what? Patients can also have that right now. So imagine the future where a patient walks to the clinic with their AI assistant on their phone who is listening to the doctor and basically asking questions and empowering the patient along that care journey. But in the care app, you can really see one big area is how you can use AI for imaging, analyzing large data sets to identify patterns and be able to recognize a cancer, like I showed in the beginning of this lecture, with how you can use freely available tools to just do that. And then democratize access to expert level diagnosis and decision support. So there are many tools that you can use for AI in care. But what do you think about outreach? Actually, on this call, we have Dr. Gloria, who is already setting up healthcare kiosks in churches, in communities, and that's going to be part of the big future of this C4 Comprehensive Cancer Center in the cloud, is that you can bring, for people who don't have, say, oh, I don't have a phone or internet connection, what if you could bring a healthcare kiosk into your church or your religious organization or your gym or some, your community where you can have access to that. You can go in there and you can consult remotely. You can do a number of things, without having to go to the hospital. And then I'll just tell you that AI is being developed right now in research for as a co-investigator, as your partner in developing hypotheses for research, and also for clinical trials. Stephen mentioned that we're actually using that already for using online platforms that can be used for clinical trials, where AI can support in recruitment and also helping with the quality of the clinical trials. And then finally, education. AI, the question is, how is education of the future? Are people going to be able to need professors like me or others the same way? Residency training that you have to do. Do you still need to spend 5 years in residency doing the things that AI can do? So education is going to be very important, how we change the curriculum of the future. AI is going to be very critical there. So I'll just show you a few pictures here. So this picture shows you for teleoncology, how you can have doctors sitting in Boston and working with doctors in Kenya, essentially with AI support, to do remote treatment planning and quality assurance and teleoncology. For outreach, healthcare kiosks, bringing that to churches. One of the big things that we've been doing as a global health catalyst is actually organizing these yearly summits. Conferences that bring people together that can talk about collaboration. But outreach is going to really be important here, and we can definitely use AI tools to do that. I'm going to skip through this and just talk about, one way that you can use this for research. Stephen mentioned the Hypo Africa clinical trials. This is a clinical trial that we are already doing, network that we're doing across Africa, involving Uganda, Tanzania, South Africa, and a growing Nigeria and other countries that are being part of this now. And basically Saturday at 11 o'clock today, these doctors like Dr. Alabi and others join online. And so we see a future where, with AI tools like Dr. Alabi showed, you can basically use that, to help advance, to enhance oncology care, and including clinical trials, the quality assurance of that. And then lastly, Stephen talked about the virtual reality and how AI is being used for education purposes, to enhance education. We have a global oncology university that you guys are already familiar, through which this course is being offered. And I think that this is something that, that's just going to grow. So you have faculty that who are teaching this from the top world institutions, but also partnering with institutions in different countries. We just signed, for example, an MOU with Ozima University in Kenya. That's going to be one of the hubs where you can access the best quality of education from anywhere in the world, and that's going to involve AI, like this course that we're talking about. And so, I just want to, because of time concerns, just kind of go through these questions that, I think, you may have received on the chat if you haven't, and then we'll give some time for questions. So what is the most significant ways that AI can enhance diagnosis? So this is a multiple choice question, and I just want you to kind of think a little bit about this. So A, by replacing oncologists in all clinical decisions. B, by detecting mutations using physical examination. C, by analyzing large data sets like imaging, genomic, and identifying patterns. And D, by reducing the need for cancer screening altogether. I would like to see what your answer is, A, B, C, D, just to get some interaction here. All right, fantastic. Everybody seems to be in agreement. C. Yes. And again, I want to highlight that this is going to be the big lecture next week. How you can use AI for imaging in pathology. We have a big expert who is going to provide tools and share about the tools that you can use for this. Okay, excellent. Thank you, guys. So now question 2. In the context of the Comprehensive Cancer Center in the cloud. So this is the vision that I would say this is the vision. We have the tools now, and we are bringing these tools together. I would say that we actually have a conference that's coming up in September. Some of you already been notified about that, where we want to award certificates for this course. And that conference is going to focus on the Comprehensive Cancer Center in the cloud. And so you bring all these tools for prevention, diagnosis, treatment, palliative care, research, education, and put that on one platform where everybody can access that. So this is something that's coming up. And so what do you think such a platform in the context of this, what would be the benefit of integrating AI into this? A, restricting access to cancer expertise to urban areas. B, automates all treatment decisions without human without humans. And then C, democratizing access to expert level diagnosis. And then D, increasing the cost of cancer care in remote areas. So if you paid attention to the C4 introduction that I made, what do you think would be the correct answer here? What do you think having a platform that everybody can access, what would that help to? See what is having the chat here. Okay, 2C, excellent. Thank you, Gillian. Thank you, Susanna. Everybody agrees this is C also. So democratizing access, that's the real thing. So it doesn't matter where you are born, you can have access to the same quality of care. All right, 2 more questions. Which of the following is a real-world application of AI in oncology? A, generating synthetic chemotherapy drugs on demand. B, predicting the treatment response. Predicting the treatment response using radiomics and genomics. C, curing all cancers using AI-generated diets. D, replacing all clinical staff in cancer hospitals. I'd like to see what you think here. Which of the following is a real-world application of AI in oncology? Let's see. Excellent. So this time 3 is B. Excellent. Thank you, Billy. Tony, yes. So everybody agrees that this will be for predicting treatment. Excellent. So you definitely, you guys are on a roll today. Okay, excellent. And then the last question, how does AI contribute to personalized cancer treatment? How do you think? A, by offering the same treatment to all patients. B, by ignoring patient-specific biomarkers. C, by tailoring treatments based on molecular and clinical data. And then D, by limiting therapy choices to reduce complexity. All right. Let's see what you guys think. All right, again, C. So C has been the predominant answer today. All right, wonderful. Yeah, so that is excellent by tailoring treatment. And I really see this once you start, you can train the models, you can be able to really have treatment that's personalized to the patient. And so this is the future, one of the future advantages of AI. So thank you very much. I just want to end by sharing some, I want to mention that we do have for the upcoming lecture next week, we will have focus on diagnosis, and we will send this lecture presentation to everybody. It's recorded, so if you missed it, you can still access it. But I want to stop sharing for a moment, and for the next 2 minutes, I know we've gone over time, just give a chance. If you have any questions for me or Dr. Stephen on any of the content that we share today. If you have any questions, you can, let's see, there may be questions in the Q&A. Yeah, I think most of those have been answered. Yeah, for the attendance, Dugan just posted the Google form. Please go ahead and answer the questions there, just for attendance for the certificate of participation at the end of this course series. Okay, so I think that most of the questions have been addressed. If there are any other questions that you may have, either like Stephen talked about, and Dr. Labi, if you can send those questions to us, we will, when we post the lecture video, also provide the link where you can send any questions that you may have. And then, I would really like to invite you to attend the next week's lecture that's going to focus on pathology and how you can use AI for diagnosis, and really providing a tool that, people can actually use in their local hospitals as well. So with that, I would like to thank you all again. Dogun, do you have any final remarks before we close for today?
Yes, thank you so much for all of the incredible lectures. I just want to send a reminder. I will be sending the recap email after this lecture with some of the information regarding the recording, as well as just other reminders about the future lectures as well. And I will try to get some of the information regarding the course Dr. Avery spoke about and include that in the email as well. And there were some comments about the link not working, but people have been responding, so that link should be working. But if it's not working, or if you were not able to access the survey, you can just email me separately and I'll mark your attendance. I will leave my email here. But that's all. Thank you so much for coming, everybody. See you all next Saturday.
Thank you so much, Dogun. Thank you, Stephen.
Yeah, thanks, Will. Thanks, everyone. Thanks.